Good morning. So I think we're ready to start. And this session is a parallel session on the mitigation from the healthcare system, which is, we'll discuss with the other speakers, a perfect follow-up with the plenary we had this morning. You have all seen the data about the impact of the sector on climate change. And so we are here today with our guest expert speakers to discuss what are the efforts that can be done at national, international, industry level and health facility level. My name is Arianna Gamba and I'm the Director of Programs at Healthcare Without Harm Europe. We are an organization, we're a network of thousands of hospitals, healthcare leaders and professionals. We have members across Europe and partners across the globe. And together we want to prove that it's possible to deliver the highest quality of care in a way that is sustainable both environmentally and financially. We have three main program areas. One is climate smart healthcare, circular healthcare and safer pharma. And so all these topics are linked also to the triple planetary crisis. Very briefly on the impact, I think you've all seen this slide already, but it's important, this is a report that Healthcare Without Harm published together with Europe about the impact of the healthcare sector. And I want to emphasize that if we don't act, the emission could triple by 2050. And also that the biggest part of the emission are coming from scope 3, which is the product that the sector buys, the supply chain of the sector. At Healthcare Without Harm, we work on three pillars, which is the decarbonization. We have different projects looking at that. We also work on resilience. We heard it this morning. The two things go in hand, have to happen in parallel. And then we also work with healthcare professionals on the advocacy and policy side. I will now, after this brief introduction, hand over to our speakers. The first, so we will go in this order. We will have Kirsty first. She's from the European Federation of Pharmaceutical Industry and Association. And she will talk to us more about the efforts done by the industry. We heard this morning from Philips, more ICT and digital, and now an important area is pharmaceuticals, because we know that medical products and pharmaceutical have a big impact on the environmental side of the sector. Kirsty, the floor is yours.
Thank you so much, Arianna. So just to start this off, I'm representing EFPIA, which represents the research industry, so the innovative pharmaceutical industry. And the industry really strives to improve health and well-being of patients, and therefore that's why it's very important we also take into account the impacts that the climate has. And this is really an important issue to the industry. So I was trying to think of the best way to explain it, and I see it that a lot of people talk about roadmaps, where to get to in the future, and we're on a road trip. So we're going on that road trip, a climate-neutral road trip. And it's going to be a long road, but we see that there's a need to be on this road trip. And the important part is to do it not alone, but we need to be doing it with all the stakeholders and in partnership and in collaboration. This slide just gives you an overview of EFPIA representing 37 different national associations. So we represent also across the different EU or EEA member states, and then also 40 of the leading pharmaceutical industries. And we really understand the importance and identify the relationship there is with the climate and the health. And we're looking at ways as an association, but actually also as individual companies, but also alongside in collaboration across the different stakeholders of how we can move forward in ensuring that we have more sustainable productions. The slides are very small. I hope these are going to be shared afterwards. But what I've tried to really show you is that industry is involved in a large number of initiatives, some of them driven by industry, but sometimes driven by others. What we've done at EFPIA as an association, we've gathered information on what companies are doing across the board on climate change and also what they're doing on circular economy. And we have publications on that where we bring together the different case studies that different companies are engaging in individually on their sites. So that would be like scope 1 and scope 2 emissions, but also looking at what they're doing collectively to counteract those scope 1 and 2, but also across into scope 3. We're also involved in a large number of projects. So I'm not only concentrating here on climate change, I'm looking along the whole life cycle, because of course we have to look at how we're impacting not only the climate emissions, but also the way we're impacting pharmaceuticals going into the environment. So we're part of a number of projects looking at prioritization of the environmental risk assessment, and that's under the Innovative Medicines Initiative, which is part of Horizon Europe. It's the biggest public-private health partnership globally, and that came to an end, or the IMI came to an end and kicked off then with the Innovative Health Initiative, which is now projects looking and working with not only the EFPIA, which is the pharmaceutical industry, but also across with the medtech sector. And last year we had 2 calls go out on sustainability, or projects really looking at how we can reduce our impact on the environment. And they're now in their second phase of preparations, where they've now brought in the public and the private partners to work together. And one of the projects, just to call it out, is really led by the medtech sector, and it's looking at the safe and sustainable by design of packaging, and also the single-use device solutions for healthcare. And then another project that I can even call out what it's going to be called. It's called Farm Eco, and that project will launch later this year, and that's looking at the sustainable circular development and manufacturing of healthcare products and their quantitative impact assessment. So really looking at the whole manufacturing processes and how they can become sort of greener factories, for example, and that project will kick off hopefully by the end of this year. But I've also called out within the slides that are represented different projects that we're engaging in, and also some outputs that we have on our, we ran 3 different surveys across 2017, 19, and 21, looking at the climate impacts that our companies have, climate neutral sustainability strategies they have in place, but also their way of how they've been able to reduce their impact on the environment. And just to call out some that you can't see up there, but looking at scope 1 and 2, over 3 years, our companies have been able to decrease by 10% their emissions, their greenhouse gas emissions, and that's approximately 1.5 million tons. But we have to call out very much so that most of the impact coming from the healthcare sector is really on the scope 3, and that's 88% of our companies, on the healthcare sector, 88% really comes through emissions in that effort. And what we've seen actually looking at our companies is that now 95% of them, where previously I think it was only in the survey we'd done previously, there were about 45%, now 95% are actually working with the different suppliers across their supply chains to ensure that they're looking at more sustainable methods in decreasing their scope 3 in the future. But as I said, we're on a road trip. We want to join and be part of the collaborations, and I look forward to hearing what the other speakers have to say, because it's important that we are engaging with them in this process. So thank you very much.
Thank you very much. So this is very good progress and very good to hear. Then let's move now to the healthcare facility level and hospitals, and how you are trying to mitigate the impact and also work with the other, with the industry and other stakeholders in this field. So, sorry, I forgot to introduce you, Edda. I was caught in the discussion. So we have here with us Edda Weimann from the Munich Municipal Hospital Group. She's a professor, pediatrician, and CEO of the Rwanda Heart and her Research Center in Kigali. She also worked a lot with Healthcare Without Harm Europe in the past on different projects. So it's really a pleasure to have you here and listen more about your journey. Yeah. Thank you.
Thanks, Arianna, for the introduction. Yeah, it's really a pleasure and honor to be here and share, insights and also learn from each other. And as Kirsty has mentioned, we are all on a road trip, and I just want to zoom in a bit into hospitals and what's happening currently there might be happening there. So, well, it might be a bit contradictory presenting Munich hospital group, but currently I'm working in Kigali as a CEO of a new hospital, and one of the major reasons, apart from the job, really was to accept the offer, was that Rwanda is really a leader in sustainability. And when you go there, it's one of the really very poorest countries worldwide. It belongs to the low-income countries, but they are plastic-free. There is a ban on plastic bags since 2008, despite really difficult political and economic situations. They were able to launch that and to show the leadership. And Kigali and Rwanda is absolutely spotless. I've never ever have seen any place like that. When you go around, they have community days to clean up on a regular basis, on a monthly basis, their environment. They are very proud that they do have a clean environment. They have e-bikes in the city and, for example, battery exchange possibilities. And I think it's just amazing. And when you just see it on a Sunday, how people enjoy really being outside and on the streets where there's normally a lot of traffic, it's really a plus, yeah, a plus on life quality, and I think we have to get rid of this, or we just have to deprive and have to go to a lower standard of living when we adhere to sustainable measures. I think that's really a plus in life quality. Yeah, and that's a heart center we are currently building, and that is under construction. Also quite a nice setting on the medical campus that was donated by the government. That's currently the state of the hospital. It's Arup certified as a sustainable hospital. So we have already taken environmental sustainable measures in place, also doing local supply chain, also looking for or built-in natural ventilation, biodiversity garden, as you might see, stormwater drainages, as we are having quite heavy rainfalls in the tropical area, but also related to climate change, become more and more intense, looking for energy efficiency and also implementing digital health through electronic records and IT networks that are already in place there. And one of the reasons I also came here was just that we want to implement also solar panels on the roof, quite a huge number for 4 or 5 kilowatts solar station. Kigali, Rwanda has one of the highest energy costs worldwide, but it's in the top 10 percentile, and there's definitely a need to save energy. Yeah, and it would be great because normally it's a charity hospital and it's done by funding. And we are also offering services for free, heart surgery, for example, for free to patients. It's quite an effort to get all the funds together. And yeah, it would be great if there also would be opportunities from the European Union or other funders to get support for the solar panels. And I would be super grateful if I could get some recommendation from your side. Yeah, and the last slide is really covering what you can do to address sustainability in hospitals. There are quite a number of measures I've listed here that are, in a way, success factors. Also, doing what Arianna has mentioned, also engaging with Healthcare Without Harm and doing a lot of projects to increase sustainability in the hospital. That's done in the figure on the left-hand side. And also implementing a sustainable balance scorecard, that really sustainability is embedded in the hospital management and not done as an add-on or nice to have or a niche. So it's really a central part of hospital management. A climate dashboard would be great also to visualize to staff, but also to the public, what's done on a monthly basis, and also show decreases, for example, in carbon emission, in waste, in plastic. Then also implementing an interdisciplinary zero emission team, also to cross-pollinate each other. We met there once a month, and it's really interesting when there are obstacles that often from other sectors, there are inputs and suggestions to overcome roadblocks. And information and education is quite important. So we have put off, for example, information boards in hospitals, and also educating staff, but also patients. And there's the need for education regarding climate change and sustainable hospitals is still quite high. Yeah, that brings me to the end of my presentation. Thanks very much for your interest and listening.
Thank you. Thank you very much, Edda. It's very interesting to hear more about this experience in Europe, but also outside of Europe, and there is a lot we can learn. We will go now to the next speaker, who is sitting next to me, Colin, from the Irish Department of Health. He is a climate change specialist at the Department of Health in Ireland, where he leads and coordinates climate adaptation and mitigation. And he also represented Ireland international climate health events at UN, UNFCCC, IPCC, and WHO levels. And he chairs the WHO Partnership on Healthcare Sector Climate Action. We heard this morning about Ireland. So the floor is yours.
Is that on? Yes, it is. Good. Yeah, so thanks very much for the kind words, and thanks everybody for the speakers before me. And indeed, I think in the plenary hall this morning, I think what I've really picked up is how there is a commonality of the nitty-gritty of what we're all trying to do. We all have different types of health sectors, and we come from specific industries, but the types of things we're trying to do are largely, they're the same stuff. So what I was going to do, I have killed it. There we go. There's two things I want to talk to. The first, I suppose, is the approach Ireland is taking to addressing emissions across our health sector and expanding our adaptation programme. And then the second is the aforementioned partnership on health sector climate action. So I suppose some of this presentation will be slightly boring, so I'll try and minimise the boring element of it. But like I said, different countries do health differently. They have public sector, private sector, regionalised, nationalised, etc. But the types of issues, like I suppose the first thing we did across our health system when we said we wanted to go at this properly, do a strategic approach to it, was to examine across the different areas and look at international examples. I think the UK at the time were the only other country that had done something like this. So what we came up with was these 6 priority areas of focus. We have sustainable buildings and the green environment. And in that context, we're looking at the emissions associated with heating and power. We're looking at energy efficiency. And then I suppose we're also looking at kind of the green environment in which many of our healthcare buildings sit. Then in terms of transport and mobility, we're looking at everything from the freight of medicines and healthcare equipment, and we're looking at staff travel, we're looking at patient travel. Under sustainable procurement, there's, I suppose, direct procurement and there's supply chain. Under greener models of healthcare, that's everything from, again, we saw examples earlier about virtual consultations or the types of medicines you're using. I think desflurane is something that tends to get mentioned a lot at these types of conferences. We could do it about 1,000 more desfluranes across the broader health system, but there's one anyway. Water and waste management would be a focus on reducing the amount of water use, reducing waste, looking at the food in our health systems, in our hospitals. And then under adaptation and resilience, we're building on a body of work we started out back in 2019 across our health system and across Ireland's broader system on the health impacts of climate change. So we're looking at probably more frequent extreme weather events, the spread of exciting new infectious diseases that don't seem to die in my part of the world anymore, and a lot of the other adaptation issues that have been touched on. And I think this kind of brings me on to the second slide, which is the partnership on health sector climate action, which was launched at the Environment and Health Ministerial Conference last July. And what we're trying to do with this, and it kind of touches on what's been said earlier about, you can have a hospital that does a body of research into where are our emissions coming from, what can we do? And different hospitals have different sizes, different capacities, but you can share the hell out of that stuff. And likewise, there's no need for every country to start from a blank sheet of paper if they're looking at what does climate action look like in our health system. And like I said, even though we all do health differently, the key is what we're looking to do is to get into a series of deep dive sessions which will pick a theme. So it could be transport in the health sector. And you could come from the States, you could come from Luxembourg, and what you're talking about in terms of transport is going to be wildly different, but the people who are responsible for that and the types of actions that work, there'll be a commonality to that. If you're looking at the built environment of your healthcare system, a deep dive into that can look at options in terms of reducing energy use, improving, solar panels, etc. What's doable, what's viable, where the efficiencies can be found. And that body of work is going to start this year. So I think we've scheduled our first meeting hopefully for May, and we'll do one of our first deep dives then before COP29. So I suppose between the two, I think that I've seen it now, Australia have also published their national healthcare climate strategy. And once you have a strategy, you give a hook to the people in your hospitals, to the people in the institutions, to the people in your pharma sector, etc. Here is a hook that I can engage with a national structure and reach out and make this part of what we're trying to do. You can validate industries' approaches to reducing their emissions, give them a reason to do it, give them a reason to raise the cost of what they do, because increasing energy efficiency isn't free. So I think that between the two, we've put ourselves on a pathway, and Healthcare Without Harm have been very helpful in terms of mapping out that pathway to net zero. And if we can kind of share that kind of experience, but particularly through those types of deep dive sessions where as countries identify, or sectors or hospitals identify, we found a new one, here's a thing you can do with x-rays or whatever it might be. Get that out there, let everybody know. And also, if you try something and you put a load of money in it and it's rubbish, get that out there too. Let's not all do that. So I suppose I just want to thank everybody, and I'm looking forward to hearing more about within individual sectors what else can be done. So thanks, Arianna.
Thank you, Colin. So our next speaker, and we will discuss more about that in the discussion. I also want to encourage the audience to put your questions through Slido, because we want to allocate some time for questions from the audience. So please do so. Our next speaker is Dorothea from the Center for Planetary Health Policy, and she's research associate there, and they're based in Berlin, where she focuses on implementing planetary health in the German healthcare system. Dorothea, the floor.
Thank you so much. And yes, very inspiring to hear from all these examples. Also earlier, I see Karolinska Hospital, you're here as well. Yes, I hope I can kind of add a little bit and won't repeat too much about what's already been said. Just very brief, oh, no, that was too quick. There we go. Very quickly about CPHP, because I'm sure none of you have heard about us. We're a think tank based in Berlin. We're part of an NGO called the German Alliance on Climate Change and Health, which is very similar to Healthcare Without Harm, but operating in Germany. So it's really to increase awareness about the impacts of climate change on health, helping the sector to transition. And the think tank is really there to kind of really be that translation agent to translate scientific findings into policy advice. So all of what we do is really focused on policymakers, really trying to advise them on how to get the adaptation and mitigation measures that we've heard so much about into policies as quickly as possible. So this is what I'm going to talk about very briefly, because it's always really inspiring to hear what is happening in the sector and what individual hospitals and institutions do. But my opinion is we really need the frameworks from the politicians to get that across the sector, and also to get it done quickly, because if everyone has to invent the wheel, it just takes too much time, it's very inefficient. And in Germany, we really have a long way to go on this. We're not where you are by far. So for us, the main thing that is lacking is actually a national target for the healthcare sector to decarbonize. We do not have that. We have a climate mitigation law that basically tells us Germany has to be climate neutral in 22 years. But the healthcare sector is not really included, not explicitly, and we don't have a roadmap of when the healthcare sector should achieve what. A bit like the UK did, right? They established these interim targets for scope 1, 2, and 3 for their suppliers. We have none of that. And I think that's the one thing that is really quite important to make sure that everyone's on the same page. In Germany, we don't have a centralized service. We don't have a national health service. It's a more fragmented system. The private sector plays a big role, and there's a lot of sort of self-governance in the system. So you have to do it in partnership with the health actors. It's not something that the health department or the health ministry can dictate, but still they need to show some leadership, obviously. The second one, and this sounds trivial, but enabling an easy assessment of emissions is also very important, because I'm sure all of you who are working in this know that actually measuring what the emissions are like for one hospital is not an easy task. And we have some wildly different measurements for some hospitals where you know something's going on here, like it's not very accurate. There's some double counting, there's some underestimates. Basically, we don't have really a very good baseline assessment. We have a new paper now that finally has assessed emissions roughly for the whole sector, and for us it's about 6% of our national emissions and about 80% of scope 3, so again that's where the big chunk is. But I think what this assessment really showed, that there's a need to track the emissions nationally and also monitor the progress, and again this is something we don't have yet. We've heard, I think, a lot about empowering and creating change agents, no matter where they are in the different sectors. So, for example, one actor that hasn't been mentioned that much is, for us, the health insurances. They play a very big role in Germany. They do a lot of the procurement. And they are, in our opinion, some of them real change agents, or they could be. There's a lot of understanding there that it's actually in their interest to promote sustainability, but you have to enable them to actually do something. Right now, in law, it's not part of their remit. So again, there's something about creating those frameworks for them. We're spending a lot of time looking at political and legal barriers to sustainability, because right now we have a lot of those in the system where if you have taxpayers' money, or if you have the people you insure, you have to spend that money as efficiently as possible, right? So that means in law, it has to be the cheapest always. That's the main thing. And that makes sense. From an economic perspective, I don't want my money to go to waste, right? But it means that sustainability is really kind of an afterthought at best. And that really needs to be more on par with the economic incentives that are there. The next thing I've put here is starting with low-hanging fruits and tackling the big levers at the same time. So we know there are some things that are really quite small if you look at the proportion of emissions. For example, changing the food in the hospital, right? It's not a big proportion, but it's something you can do easier than other things. It's easier than, for example, insulating the hospital, right? That's a big deal, but changing the food, that's possible. So that might be a low-hanging fruit. It may also have bigger co-benefits and other issues. But at the same time, we need those big levers. So in terms of, for example, the energy and heat that a hospital needs, for example, that is a big deal. You need a lot of investments. And it's also a long-term issue. So if we have 22 years, we count back again, we have to start now, because we can't do that with all hospitals that we have at the same time. The other thing that we discover again and again is letting people take ownership of areas that they are best placed to change. So, for example, if we look at the anesthetic gases that we were talking about, desflurane, I don't think our minister has to deal with that. That's really what the doctors are for. We have doctors' associations who deal with that. So really kind of see who's best placed to make certain changes and give them the ownership of those decisions, because sometimes that's more powerful than having someone at the top somewhere in politics deciding something. Sometimes there's a bigger backlash to that, isn't there? I think we've talked a lot about emphasizing the positive aspects of mitigation measures. I don't have to go into that really. Big one, the fiscal question. We have to talk about it. I think in a lot of countries you probably have the same. There's no additional money to have to kickstart some of the sustainability measures that need to be done. So, for example, insulating the hospitals or creating an energy change, or whatever it might be. And then it's very limited what you can do. We have to be honest about that. Like at the beginning, we may save a lot of money later on, but at the beginning you need that investment. And I think sometimes we shy away from those discussions a little bit, or it's just because of the fiscal situation that we're in, it's just not possible. And sometimes those discussions, I find, can be very paralyzing, because it always comes back to this, well, we don't have any money, so we can't do anything. And then all you do is have a sustainability officer who deals with recycled paper. I mean, it's really like, I have examples of that. So I think being honest to politicians about we need additional funding to enable that, but also making clear that the sector doesn't have to wait for that. They can start with the things that don't take that much investment. And then the last thing, and I always try to mention that, obviously the most effective measure is prevention and health promotion, because the most sustainable healthcare is the one you don't need, right? And certainly in Germany on public health, we can do a hell of a lot more, also on all the things that we mentioned in terms of planetary health diet or active transport, air pollution. All those things would make the healthcare sector obviously much more sustainable, more than all these other measures I've mentioned. Thank you.
Thank you. Thank you very much, Dorothea. Thank you very much to all the speakers for providing this insight and perspective. I heard a lot of interesting points that we can explore in our discussion. One, I heard a lot about the barriers, right? So incentives, money, there's always a big thing. I heard about green teams, and I had a question about, how to build your green team. Is everybody on board? I open the floor here to the speakers. Do you want to talk more about what are your challenges in this work? I also heard from Kirsty, this is a journey, right? So what is not working? What do you want to see that is helping you? Especially, let's remind ourselves that this is a research conference. So how can research help you in this journey?
Thanks, Arianna. And what I did notice was we spoke about very different things, but we had very similar points where I was noting down some of the challenges. And I'll start with, for example, let's start with Edda. For example, you mentioned the funding, and that's really necessary. That's very important. We need to make sure that the funding is coming through and it's being directed into the right place. And I find that's why this conference is extremely important, because we're identifying where those gaps are. And hopefully that's also helping with the networking of bringing people together. The big thing that Colin mentioned was we have different healthcare systems. And yes, our healthcare supply chain is very complex and it's very fragmented. And we're involving numerous different stakeholders, manufacturers, distributors, healthcare providers, the industry, all the regulatory bodies all being part of that. And I think that's where it complicates it. So it's really about trying to find a mechanism to ensure that there's more of a way, and I like this idea of putting strategies in place, because I see that as a way to sort of break down the complexity. One of the big things that also stood out and was mentioned was really regulatory compliance. And I think that is also what hinders us sometimes, is because we have such a stringent regulations in place and standards that we have to follow. And sometimes some sort of flexibility would enable us to be able to move to a more sustainable way of working. And we are bringing those discussions already as industry, taking it to the EMA to ask them, we want to evolve, we want to become more sustainable, we want to become more climate neutral. How, as you as a regulator, can you help us in that process also by looking at the regulatory process that are in place? So.
Does this apply also, for instance, to, changing product composition also? Because I was discussing a pharmaceutical company, we want to phase out this chemical, but then we have to go again through the whole market access, and that takes a lot of time. Could you talk more about that, perhaps?
Definitely. One thing about phasing out a chemical, it's also about making sure that we don't have substitute it with something that actually makes the process worse. So let's not talk about specifically replacing one chemical with another, but if you are taking out one chemical and changing to another, maybe you're changing the whole circular economy process where you have substances or a medicine that doesn't last as long anymore. So you're having to replace medicines and produce even more because they're actually expiring quicker, or the machines you're using are breaking down quicker because you have to replace the parts every few months rather than every 3 years. So that's also a process we have to take into consideration when we're looking at how can we move towards decreasing our emissions. But specifically, yes, looking at replacing a substance in a medicine per se, we're very much part of, we're all hearing about the PFAS discussions at the moment. We use PFAS in production of our medicines, in our packaging, and also within medicines. But we need to also look at the type of PFAS, because that is such a huge broad terminology that is used when some of the PFAS, we've never considered them in the scope of a definition of PFAS previously. But any change we do make is a very lengthy, long process. We have to go through the whole market authorization process, generally for any variation in the medicine, or even in the packaging if it's part of the market authorization process. And that leads to long times for where we have identified a valuable substitute, but the time to take that cannot be done overnight, and it cannot be done within a year or two. We're talking about 5, 10, 15 years, and that is very much because of the regulatory process behind it, yes.
Thank you. Anyone else on the challenges? I heard you, Colin, laughing for half an hour of challenges.
Yeah, I mean, I think this conference in general has been running slightly over, so that's a dangerous question to ask. I don't know when people are flying home or what they're doing, but no, I mean, I suppose just touching quickly on some of the points that were raised in the questions in terms of the types of supports that can help this happen. I mean, if you look at the EU and the body of work on the taxonomy of sustainable activities, that gives a benchmark for industry to say these are the milestones by which we can give a guarantee to our purchasers that we're not greenwashing, that we're walking the talk. You know, I suppose you'd look at the F-gas regulation that's going through at the moment. You'd look at the clean air legislative framework that's being put in place. I mean, I think there's a lot that can be done at that level. And I think touching on a lot of what's been talked about there, like some of the big challenges like Scope 3, I mean, I come from a climate background, so if you look at reporting on climate action under the Paris Agreement, you know, no one wants to talk about Scope 3. It's each country has responsibility for their own emissions, but it's the massive elephant in a small room when it comes to the health sector. And like there's a body of work going on under ATTACH at the moment to look at a multilateral engagement with supply chain on the emission sources. And again, I think, you know, I'm a proud Irishman, but I know that if I ring up Johnson & Johnson and say that if you don't have the emissions associated with all your pharmaceutical products, we're going to stop buying them, they'd be like, I'm not sure we'd even notice. But if you can get 10, 20, 30 countries to all work with a combined set of questions and a combined set of these are the criteria by which we will accept that you are on the pathway that we want you to be on, then suddenly you give a mandate to Johnson & Johnson, to the bigger pharmaceutical companies to say, our suppliers, you know, our investors are keen for us to do this, but we need to be economically viable. But now, if we get an assurance and a kind of a long-term assurance from national and international commitments that this is the direction of travel, we can justify spending extra to, you know, extra research on lower carbon alternatives. And I suppose, again, touching on my climate background, one of the particular challenges in the health sector is I'm not a doctor. I'm not going to have a conversation about the propellant in your inhaler and, you know, could you use this instead? And I could kill a swathe of people in my country. I think it's the one sector that beyond anything else, I mean, you look at agriculture, power generation, transport, it's a fairly logical argument in each of them. In the health sector, you're relying on research, you're relying on bottom-up identification of low-carbon alternatives. That 5% number of how much the health sector contributes to the global emissions, like, it's made up of a huge amount of little nitty-gritty bits, but in each case, first of all, there's a conversation to be had with the experts on what does ambition look like. And ambition could be, genuinely, if we can reduce our emissions by 5%, that's all you're going to get out of this niche. But let's do the 5%. If there's another area you can get 80% out of it, let's get the 80. But that conversation on the baseline and the identification by medical professionals of this works, this also works, and is a better idea. And as Kirsty talked about there, I mean, those are complex questions. but I think having a momentum now and a sense within the health community that there's a voice for them and a role for them in the climate conversation. It touches, and I'm just going to keep talking. It touches on. There was another question on the Slido there about engagement with your healthcare system and people who the healthcare system globally is constantly under stress, overworked. If I looked at 100 years of the the existence of Ireland as a country and go through the national papers each day, if I get to the third page before there's a health crisis or health emergency or health issue, that's a good day. And in our case, I think the health system is probably the biggest employer in the Irish state. So trying to engage with a sector that's facing the types of challenges on a daily basis that the health sector faces is a challenge. At least in our case, we don't have the challenges of Germany. I mean, it's the one occasion where I'm thinking, phew. But I think that, that type of engagement with your sector across the staff, across the different supply chain is a complex challenge, and it's one that needs, it needs coordination. And I think that it needs a long term. There is momentum coming from individual hospitals, from individual sectors, and you need to harness that and build it. You can't let it just fizzle out because, as Dorothea put it, you have somebody who becomes the job of the sustainability officer and all they get to do is the recycled paper. You need to build on this.
Yeah, thank you very much for bringing this up. I want now to move to healthcare professionals. So if Edda, you could respond on this and also tell us what you think is the role of healthcare professional and how do you see healthcare professional, if you see that they are included enough in the political participation, because we heard from Dorothea, it shouldn't be the ministry to decide about anesthetic gases, it should be doctors. We need research and doctors to identify low carbon solution, what can work for the patients.
Yeah, thanks for the question. It's a very complex one because in a way you also need enablers as healthcare professionals. We are professionals, but also we just are asked to do the job, in a way. So to run a hospital, to treat patients, to have a high patient satisfaction. So that's in our job description. And we also did, for example, recently a research study comparing, for example, the UK health system together with the German health system. And sustainability is just not in its job description, very differently to the UK. So there's no offer to us to engage in a very sustainable way. And now it's the third hospital. I'm just trying to get engaged into sustainability. And whenever I talk, fortunately, I'm now the boss, that might change a bit. But whenever you talk to the CEO, it's always, oh yeah, if you want to do it, you can do it after work. So it's really not at the central, it's not the central target of healthcare delivery currently, from the mindset. And the mindset in different countries and having worked in different countries are just different. And when you talk in Germany, it's always about money. And it always has to be cheap. So that's the first thing. And even just getting the people on board, like the financial officer and even the board of a hospital, it's extremely difficult because there are just other vested interests in these boards, and that really has to change. But that's also leadership, necessity to do it, and it's a leadership necessity from the Minister of Health, I think. That really has to come from the top. And that was also very different in the UK, where the ministry and the government finally decided we want to do this. We want to achieve it, and we want to achieve it within a certain time frame. And then it just ripples through and just is ingrained in the culture. And we do not currently have that sustainability culture in the German healthcare system. And we really have to fight for it and push it. And that's also something you are doing in Berlin, just to get a consensus in the society that this is important and not an add-on and nice to have.
And it's again linked to prevention. I also want to make a small comment. We heard a lot about it has to be cheap. I think it's important to remind the room the difference between price and cost, because it's very two important things. And Of course, if you're looking at the product price, probably the single use and so on is the cheap one, but then we also have to look at the cost. And I think this is also another area where research can really help in assessing the environmental and climate costs of the products we're using and buy. Because I hear a lot about cheap, but cheap, it has different perspectives. And so we have to be careful when we say price or cost, because it's two different concepts. I want now to open to Slido because we only have a few minutes before closing up. I hope we can see, so we have, let's pick a couple of questions. We want to have more votes. The first one is, what are the initiatives needed to educate people working in our healthcare sector to go further with the implementation of more sustainable practices? So educating healthcare professionals, I understand, with this question. Edda, what do you...
Shall I go for this? That's super important. It's in a way a very tedious process, but I think, as Kirsty has also mentioned, you have to get your role players involved, and the staff and patients are very important role players. And interestingly, I started to give talks on sustainability and on sustainable healthcare to staff. Yeah, just to alert them why it's necessary, why we have to do it, why we have to do it now and cannot delay it to do it in the next 20 years. And it's an urgent and pressing issue. And that's super important, but it's also important to talk about patients about it. And that's quite a challenge because they are also coming from very different educational backgrounds. Yeah, I think you have to stand the ground if you are really doing it. But they also need to know why, for example, we are just engaging to have meat-free meals. Yeah? And that's, for example, working in Bavaria, I can tell you that was a major challenge, although Dorothea said that's the easiest thing. You can just come over and try it there. So that was a revolution, almost, that we do not serve meat for one. It's only 1 day a week, yeah. It's a cultural, it's really a cultural change. And you have to engage with the people and also, ask questions and also find answers for their questions and their resistance. And I think we also have to acknowledge the resistance and have to deal with it. And it's an important task, but it's quite time-consuming. But if you want to be successful, you have to do it.
Thank you. Thank you for answering this question. The next one, I'll get started with Dorothea, because I think this is where Germany, maybe the German experience could help. How can you ensure supplier compliance in reporting sustainability data? There is not even a methodology put in place. I know that Germany was leading, on the corporate sustainability directive and so on, one of the leading countries. So I don't know if there is...
The emphasis is we were. Well, indeed, we actually have our own sustainable supply chain law. It came into force, so now 2 years ago. It doesn't cover climate change primarily. It's more about human rights. But at least there is a mechanism already for the big companies in Germany in place to kind of look at their supply chains. And then also, I would say, with the sustainable reporting directive, I think that also has already made an impact. I'm sure you can testify to that as well. And I think regulating supply chains, I mean, there's no way around it. I think it's absolutely important. And for this year's DDD, I think that was a big chance because it would also have incorporated climate change more. Now, I'm aware that Germany is the reason why it's stuck at the moment, and that's really a big problem, I think, because it would be so important to get it on a European scale, because exactly what you were talking about, when we talk about global supply chains, we hear it all the time from actors in Germany that they say we can't do it alone because they won't care if we don't buy from them. It has to be a whole of Europe kind of approach. So that's really, I mean, the CSRD, I think, is making a difference already, but obviously the supply chain law would be really important. I don't know if you're going to get to the third question, but I think it's such an important one as well, to think about how we can actually, oh no, it's changed now. But anyway, it was about the system as it is, and that's also what we try to emphasize, because sometimes we think about decarbonizing the healthcare sector separately from all the other health policies, but really it should be joined up. So for example, in Germany, we have a very high proportion of inpatient care compared to other European countries. So a lot of treatments are done as inpatient care that could possibly be done as outpatient because other countries do it. And we have a hospital reform at the moment that is supposed to kind of tackle that and other things like over treatment generally, but no mention of sustainability. So thinking that together is not really there yet. And I think that re-emphasizes the point that it's always an afterthought. It's not integrated into policy making in general and health policy making, but it's a separate issue. And that is a big barrier, I think, to really get to the point where it's on top of the agenda for everyone, and where we do actually get not only everyone in the hospital in terms of the leadership, but also everyone who's involved in health policy making to realize that sustainability should be part of their job. And at the moment, it really isn't. I thought that was a really good question. So,
Thank you, Kirsty. So you wanted to comment?
Just wanted to add, if you need, I've got the questions here because they're quite fun. I just wanted to add on the Corporate Sustainability Reporting Directive, because we're still going to see what the outputs are, because part of it is to develop guidance, and that all companies will have to report on. So we will see a more harmonized approach and more clearer sort of information coming through. And I think that was one of the points raised earlier during the introductory speeches about we need to have more clarity by reporting in a similar way. And just where that process is companies are probably being incentivized now because they know it's coming, but they still need to develop the agnostic reporting standards, and then they're going to do sector specific, and of course pharma, biotech would fall within the sector specific. So I really think that will give us an indication and give the incentive to industry to not want to be seen as the bottom of the list, for example. So from that point of view. Then going on to the question now, I also wanted to give a little bit on the sort of how to mitigate the system that we have in place, but also looking at how we, within our companies, the industry companies, are producing. It's about looking at how can we decrease waste, how can we use more sustainable or greener chemistry, for example, how we can use more sustainable sourcing. As an example. In addition, I also noted down recyclability, finding opportunities to recycle to be part of that sort of circular process. So we're letting less waste go out into the environment, looking also how we can optimize the supply chain processes we have in place. But what's really important and what stands out in discussions in this conference are 2 points really, and that's the need for collaboration and partnerships, and also that financial incentive. There needs to be identification of funding opportunities to also be moving forward. So those are some points that...
Thank you very much. I think we have to close, and we need to wrap up because we are quite late. So I would really like to thank our speakers and give them a round of applause for being here. And just to wrap up, what we heard in this session was, again, different perspective from industry sector, healthcare facility level, policy, national, international level. We heard about the challenges, also opportunities for collaboration, and where we should work more. We heard that it's a long journey, and there is the need to collaborate, to engage with healthcare professionals, to educate them, but also to value more their opinion on the solution and the benefits of health intervention and climate intervention on health. And we also heard another important point that I would like to emphasize about harmonizing the demand for sustainability or sustainable products. So again, it goes back to procurement. How can we influence the supply chain by harmonizing our requests for a more sustainable sector? And I let you go for the lunch break, right? Is next, Martin? Or plenary. Okay, sorry. Oh, sorry.